What if I told you that high blood pressure isn't just affecting your heart? It might be quietly affecting your intimate life in ways you haven't connected. Here's something that many doctors don't discuss during routine blood pressure checkups. A study published in the Journal of the American Geriatric Society found that 49% of men ages 40 to 79 with high blood pressure experienced erectile dysfunction. That's nearly half. But here's what's even more eye-opening. Another study in the Journal of Urology found that 68% of men with high blood pressure had some degree of erectile dysfunction, and for 45% of them, it was considered severe. That's not a typo. We're talking about a direct connection between blood pressure and sexual function that most men never hear about in their doctor's office. But here's what really matters to you today. An estimated 80% of erectile dysfunction is due to physical causes, and high blood pressure is one of the major ones. The good news? When men address their blood pressure through lifestyle changes and work with their doctors, many see improvements in both their numbers and their intimate lives. And here's the kicker. Sometimes it's not just the high blood pressure itself causing the problem. Some of the very medications prescribed to treat blood pressure can contribute to erectile difficulties. But there's a fascinating twist that we'll get to in just a moment. This could mean the difference between feeling confident in your relationship or avoiding intimacy altogether. Before we begin, tell us in the comments your age and where you're watching from. We're reading every single comment. Now, let's talk about what's really happening in your body and what you can do about it. Let me explain exactly how high blood pressure affects erectile function, because once you understand this, everything else makes sense. When you get an erection, it's actually a complicated process involving your brain, nerves, and blood vessels all working together. Signals from your brain cause smooth muscle in the penis to relax and arteries to dilate or open wider. This allows a rush of blood to fill specific chambers in the penis, creating pressure that traps blood inside. That's what creates an erection. But here's where high blood pressure enters the picture. High blood pressure keeps the arteries that carry blood into the penis from dilating the way they're supposed to. It also makes the smooth muscle in the penis lose its ability to relax. The result? Not enough blood flows into the penis to create or maintain a firm erection. Research shows that high blood pressure can also lower testosterone levels, the male hormone that plays a big role in sexual arousal. So you're dealing with multiple factors at once. Now, here's where it gets even more complicated. Some of the medications used to treat high blood pressure can actually contribute to erectile difficulties themselves. Diuretics, sometimes called water pills, and beta blockers are the blood pressure drugs most commonly linked to erectile dysfunction. Diuretics may decrease the force of blood flow into the penis and can reduce zinc levels in your body, which you need to make testosterone. Beta blockers work by dampening the response to nerve impulses that lead to an erection. They also make it more difficult for the arteries in the penis to widen and let blood in. But here's where it gets interesting. Research in the European Heart Journal studied men taking the beta blocker atenolol. When doctors told patients about potential sexual side effects, nearly one-third experienced erectile dysfunction. But when patients took the same drug without being warned about side effects, only 3% had problems. This doesn't mean the side effects aren't real. They are. But it shows that anxiety and expectation can be just as powerful as the medication's physical effects. Your mind plays a bigger role than most people realize. And before you stop taking your medication, please don't do that without talking to your doctor. This is exactly why having an honest conversation with your doctor matters so much. So when should you actually be concerned and talk to your doctor? Let me walk you through a few scenarios. Scenario 1. You come home after a long, stressful day. Your partner wants to be intimate, but you have trouble getting an erection. The next time, everything works fine. If this happens rarely and seems related to stress or fatigue, it probably doesn't need medical treatment. But if it starts happening more often, it's worth discussing with your doctor. Scenario 2. Sometimes you get only partially erect, not rigid enough for intercourse. Even mild erectile dysfunction is worth discussing with your doctor because it could be an early warning sign of cardiovascular issues. Scenario 3. You can get a good erection during foreplay, but lose it during intercourse. This is frustrating for both you and your partner, and it's a legitimate medical concern that deserves attention. Scenario 4. Your doctor prescribes a new medication and you notice it's now more difficult to get an erection. Side effects from drugs cause up to 25% of erectile dysfunction cases. Blood pressure medications can be lifesavers, but erection problems are sometimes a side effect. The good news? Your doctor can often switch you to a different blood pressure medication that's less likely to cause problems. Alpha blockers, ACE inhibitors, and angiotensin receptor blockers rarely cause erectile dysfunction, unlike diuretics and beta blockers. And here's an important point. Men with erectile dysfunction are about 38% more likely to have high blood pressure than those without it, according to a study of over 1.9 million men. So sometimes erectile difficulties are actually an early warning sign that you should get your blood pressure checked. Now, before we continue, I want to offer you something that can help you start taking control today. I've created a free 7-day blood pressure reset guide that gives you simple, actionable steps you can start using this week. It includes daily action items for movement, eating strategies, and mindset shifts, all designed to support healthy blood pressure naturally. This isn't about overnight miracles. It's about giving you practical tools that can help you feel more in control of your health, including your intimate health. You'll find the link in the description below. Download it, and let's work on this together. Now, let's talk about what you can actually do to address both your blood pressure and these intimate concerns. Here's the truth that gives me hope for you. You may have much more success addressing erection problems if you manage your blood pressure first. And managing blood pressure doesn't always mean adding more medication. It means making strategic lifestyle changes. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, can lower blood pressure in as little as 2 weeks. This diet emphasizes whole grains, vegetables, fruit, and low-fat dairy while limiting salt, fat, and sugar. The target is 1,500 milligrams of sodium per day. That's only about 2/3 of a teaspoon of table salt. Now, that can be challenging if you eat a lot of processed foods like canned soups, cold cuts, or processed cheese. Your best strategy is to favor fresh foods with no added preservatives and read labels carefully. Exercise is equally important. Many studies have shown that burning calories through exercise helps you tone your body, lose weight, and fight depression, all of which have a major impact on sexual function. Being overweight makes erectile dysfunction more likely. You don't need intense workouts. Just 30 minutes of moderate exercise 5 days a week can make a real difference. With a leaner body and better sense of well-being and self-esteem, you're more likely to feel sexually confident. If you smoke, that's another factor to address. Smoking increases blood pressure, damages blood vessels, and reduces blood flow throughout your entire body, including to the penis. The power to take control of your blood pressure and sexual health is genuinely in your hands. Now, let's talk about something that many men find difficult: having this conversation with your doctor. I know it's not easy to tell your doctor you're having difficulty with erections, but to get the right care, you have to be completely honest, including the truth about things like alcohol use, smoking, or any other medications you're taking. Your doctor will need information about how well you're controlling your blood pressure, what medications you're taking, and any side effects you're experiencing. They may discuss your risk factors for heart disease and ask questions about your intimate life. These questions aren't meant to make you uncomfortable. They're essential for finding the right solution. Your doctor might ask about stress levels, your relationship, whether anything has changed recently, and even about depression, which can significantly impact sexual function. If medication side effects are contributing to the problem, your doctor might prescribe medications specifically for erectile dysfunction, like Cialis, Levitra, or Viagra. Research shows these can be effective, especially when combined with blood pressure management. Here's what's important to remember. It can take anywhere from several days to several weeks after stopping or switching a high blood pressure medication for erections to return. So be patient with the process. Make a follow-up appointment to discuss your response to any treatment. If it's not as effective as you'd like, you might need a different dose or a different medication entirely. Since you'll already have regular checkups for managing your blood pressure, bring up your erectile dysfunction concerns at those visits. Doctors genuinely want to help you solve these problems, but they can't help if you don't speak up. Before we wrap up, I want to remind you about that free 7-day blood pressure reset guide I mentioned earlier. It's designed to give you immediate, practical steps you can take this week to support healthy blood pressure. You'll get daily action items, simple eating strategies, and even mindset tips to help you feel more in control. The link is in the description below. It's completely free, and it's my way of helping you get started on the right path today. And if you want to go deeper with a complete 30-day program that includes detailed meal plans, movement routines, and tracking tools, I've created that as well. It's available if you're ready to commit to a more comprehensive approach. You'll find information about that in the guide. Look, I know this is a sensitive topic, but here's what I want you to understand. You're not alone, and this is not just about aging. High blood pressure and erectile dysfunction are connected, and both can be addressed with the right approach. By managing your blood pressure through lifestyle changes, working honestly with your doctor, and being patient with the process, there's a real chance you can improve both your cardiovascular health and your intimate life. Now, if you found this video helpful, please hit that like button so more people can see this information. And if you're not already subscribed, click that subscribe button and turn on notifications. We're creating new videos every week to help you take control of your blood pressure and your health naturally. We want to hear from you. Have you experienced these challenges? What's been your biggest obstacle to talking with your doctor about this? Share your thoughts in the comments below. We read every single one, and your experience might help another man who's going through the same thing. Thanks for watching, and remember, taking control of your health is the first step to taking control of your life.